All right, looks like folks have started to trickle in and we'll continue to welcome them as they do so. But hello again, and thank you everyone for joining us. My name is Madison Gaskill, and it is my pleasure to welcome you on behalf of the Ohio Program for Campus Safety and Mental Health to today's webinar, Beyond the Syllabus, How Faculty Can Support Student Mental Health in Large Classes and Beyond. As I'm sure many of you already know, faculty play a critical role in student well-being, but research shows us that supporting student mental health can feel challenging for faculty, especially in large and high enrollment courses. So we're really excited to welcome panelists from The Ohio State University and the University of Michigan to explore how thoughtful course design can reduce distress and help faculty identify signs of student distress and address them in the classroom, all while maintaining healthy boundaries and academic integrity, which we know are of high importance to faculty. So um, jump into some announcements here, but before I do so, wanted to address what might feel like the elephant in the room today, feeling like we made a little miracle happen with OPCSMH by bringing together Ohio State and Michigan during the biggest rivalry week of the year. So just wanted to give a big shout out to all of our speakers for showing that, while we may be opponents on the football team, we're all on the same side when it comes to student wellness. So had to share that. And like I said, we'll get into some brief announcements here. As usual, CME and CEU credits are available. The activity code for today's session is 52RAGS. That's 52 RAGS. This code will expire in just 24 hours on Tuesday, November 25th at noon. So keep an eye out in the chat feature for directions on how to obtain those credits. Next, we are excited to begin offering the Mental Health First Aid for Higher Education training course coming up on December 8th. This will be a live and virtual training from 9 a.m. to 4:30. So stay tuned for registration and additional details on that. And we're also excited to welcome you to our next QPR Gatekeeper Suicide Prevention training, which will be on January 13th at noon. And there's a link in the chat there for that one as well if you're interested. As always, you can find additional details regarding these upcoming events on our website and social media pages. We also encourage you to subscribe to our listserv, which will be linked in the chat as well. All right, so finally, this webinar will be recorded and available on our YouTube. And as you will see, you have access to your cameras and mics for today's roundtable discussion. We encourage you to use those when we ask for questions from the audience towards the end. But without further ado, I'm going to hand it over to our esteemed panelists, Dr. Kate Golick, Dr. Alice Teal, Janet Jansen, and Dr. Elizabeth Levesque to briefly introduce themselves and their background as it relates to today's topic, and we'll kind of dive into the discussion from there. So thank you again for being with us, and I'll start with you, Kate, and you can pass it around.
Yeah, thank you so much. And I'm so happy to be here today. So my name is Kate Golick, and I'm a clinical professor of nursing at The Ohio State University. I'm also a nurse and a nurse practitioner. I've been very fortunate. I've been at Ohio State for around 17 years, so I've taught in both small and very large classrooms during that time. And then as far as goes, I also hold a very unique title here at Ohio State. So I am the Director of Health and Wellness Academic Programming. So that is part of my role in my FTE. And part of that is really ensuring that wellness has been embedded into the curriculum and the culture at Ohio State. So I've been fortunate to be part of several panels that have also looked at wellness in curricula. So for like the American Colleges of Nursing and some of our interprofessional teams as well. And that's a little bit about me. Thank you. I will pass it to Janet.
Hi, everybody. My name is Janet Jansen. I use she, her pronouns. And I've got three really cool roles at the University of Michigan. The first one is I'm a health promotion specialist. So I do a lot of work one-on-one with individual students who are managing their mental health and well-being. But I also play a role in academic partnerships. So I work closely with faculty, staff, GSIs, or grad assistants. And instructional assistants, which are usually undergrads, addressing mental health well-being in classrooms. And we'll tell you a little bit about a intervention that we lead out, a brief intervention where we partner with faculty and students who are enrolled in larger courses and how we kind of like bridge the gap of feeling like they're invited or uh, increasing the ability to ask for help if needed. And the third thing that I do is I work on the faculty well-being network, which addresses the larger systems and policies approaches. And one example of that would be we recently, University of Michigan last year, changed our winter break to be nearly 3.5 weeks. So really giving downtime for faculty and downtime for students to really recoup and refresh and restore in between semesters because that is well-being. And I will pass it again to Elizabeth.
Hi, my name is Elizabeth Levesque. I'm really glad to be here with everyone. I'm an associate director at the Center for Research on Learning and Teaching at the University of Michigan. And in that capacity, I work primarily with the Foundational Course Initiative. I've been in that role for about 7 years. So at FCI, we partner with large foundational courses at the university. These are typically 100 or 200 level courses that serve 120 students or more. Some of our courses range up to over 2,000 students in a semester. We partner with units, departments, and colleges all across the university. And we typically engage in 3-year course design partnerships where we work with courses to identify goals they have for revising or fully redesigning their courses. We provide course design expertise, pedagogical input, data, and assessment support. And a large part of our role is really just helping instructors design courses to support student success in whatever way that means in their particular context. So as part of that work, and as Janet mentioned, I'm sure we'll talk about this more, we partnered with Wolverine Wellness to develop a wellness check-in that's offered in large courses at U of M to help break down barriers, to help students identify resources early on in their academic career, and to also kind of break down that silo between academia or, academics and wellness and student support. I will also mention another part of my role at Michigan. I teach as part of the Summer Bridge program, so those are much smaller courses than I typically work with. So I do have a bit of that kind of instructor and staff lens when I think about student wellness. And I will pass it to Alice.
Thanks, Elizabeth. Hi, everyone. I'm Dr. Alice Teal, and I'm Senior Director of Wellness at Kenyon College, where I lead health services, counseling services, and health promotion. I'm a nurse practitioner, an educator, a wellness coach. Much of my career has been focused on integrating mental health and wellness into the everyday experience of students. Before coming to Kenyon, I did spend more than 14 years at Ohio State as the director of the online family nurse practitioner program and director of graduate wellness academic programming, working with Dr. Golick, and working with faculty on ways to support student mental health and wellness within courses and in clinical settings. We looked at courses that were online as well as on campus, large and small, really using evidence-based strategies to strengthen community and connection and reduce stress. Kenyon is a small 100% residential liberal arts college, and at Kenyon I've continued my work in wellness by partnering with departments across campus, really trying to create a wellness culture, weaving practices into courses and programming. So I'm glad to be here. I look forward to sharing more about my experience in leading these wellness efforts. I'll pass it back to you, Madison.
Wonderful. Thank you all so much again. And to kind of kick off the conversation, I'm going to pose this question to all of you and kind of curious about from your perspective, why is faculty involvement essential to student mental health and wellness efforts? So whoever would like to get started.
I'm happy to kick us off and jump in. So I would say that, we as faculty have the unique advantage of having regular touch points with our students, even more so than some of them are maybe having with their parents, at this point in their lives. So faculty are really and can be seen as that first line of contact for the student. And even in large classrooms, small, large, whatever, however that looks, we can often notice some subtle changes in students as they're kind of occurring in real time, which provides us, again, kind of that unique advantage to help and intervene before students get to the point of crisis.
And we'll do 2 Ohio State in a row this time. How about that? I would also like to add that I think that students take their cues from what faculty model. So if professors are integrating wellness into their courses, then it's communicating to students that this matters and that they matter. It's really wellness we know is foundational to learning, but to really value that and understand that and integrate that into their own learning, the students have to see that it's valued by faculty.
I really appreciate both of those responses. So one thing I'll share from my perspective. And I think I'll mention this later on as well. So at U of M, we recently developed a Canvas course, a self-paced course for instructors focused on supporting student mental health. And as part of that course, we share a bit about the landscape of student mental health. And for me, I think really the scope of the challenge right now is one reason why it's really important for faculty members to play a proactive role here. So in that course I just mentioned, we start off by sharing some information about the landscape of college mental health. So for example, from the 2024-25 Healthy Mind Study, 78% of students experience some academic impairment because of mental health challenges in the past 4 weeks when they were taking that survey. So that's many, many students, the majority of students experiencing mental health challenges impacting their academic success. And so, when you have a challenge kind of on that scope affecting that many students, I think it's really important for faculty to kind of play a role here, given that I think, like Kate said, they are the ones really often interacting with students on a regular basis.
And the only thing I would add to everyone's really great points is sometimes we live and operate in vacuums. And so sometimes it's easy for faculty to forget that the student might be having 4 or 5 other instructors inputting in their lives, plus all the other stressors of either work or family obligations. And so they are I think it is mentioned like an important piece of the puzzle of just one more touch point to help people address mental health and well-being.
Absolutely. Thank you all so much for your responses and kind of going off of that and the challenges that faculty feel or face in supporting students in the classroom. What particularly do you find challenging about supporting that in those large lecture or foundational course environments?
I'm happy to jump in here. This is kind of the water I swim in, and that I work with large courses on a daily basis. So I think that something that can be difficult is instructors may not know all of their students personally. If you have 100, 300, 400, 800 students, right? It's pretty unlikely that you're going to know each and every student. Even when there are opportunities to interact with students in a one-on-one context, like during office hours, of course, that's not going to be all your students, and you may see some students only once. So I think, from the instructor side, you might feel like you don't know all of your students. And from the student side, especially if you're early in your college career at a university as large as Michigan, you may feel like you're one among many. You may not feel comfortable sharing something or even going to office hours with an instructor that you feel like you only see kind of on a stage during lecture. And so I think that can be part of the challenge. I also think that from the instructor perspective, especially when you are teaching those large courses, it is a lot of work simply to run the course. And so I think faculty time and capacity is limited. And I think exacerbating that as well, this is one reason at Michigan we created this Canvas course. I think instructors might feel like I don't know enough to support student mental health effectively. So I'm not quite sure where to start. And I also don't know how I would learn what I need to know in order to support students. So I think a bit of kind of that hesitance on the part of instructors of not really being sure what to do or not having a lot of confidence around it, I think can be a challenge for them as well.
In addition to that, Elizabeth, I think there's the piece about the pressure that faculty feel to cover a lot of content. Sometimes those large courses have a huge requirement for cognitive load, right? So it's a fast pace. Sometimes it's very complex content, and the faculty feel really pressured to cover all of that. And if they don't know how to integrate wellness into that large classroom, so in addition to things you talked about, right, where faculty might not know all the students and students might feel invisible, it becomes really hard to break that barrier of being known, especially as you're trying to actually deal with all the cognitive load.
And I can also piggyback off that now that Dr. Teal said that. And I think, when we go out and we talk a lot about this and about how we put wellness into classes, into curricula, the most common thing we hear from faculty is like, how can we add one more thing? And, I think we really try to emphasize with them, this is something in healthcare we got wrong for years, right? Like we were like, why aren't these people taking their blood pressure medication? Well, these people, didn't know where they were going to get their next meal, or they didn't have stable housing, and so I kind of look at it in that regard of like, wellness is the foundation. Like if students aren't healthy and well, they're not going to be able to perform academically. So really kind of re-educating everybody on this is a fundamental thing that needs to be part of every single course, every single clinical, wherever the students are.
And then to wrap it up, just very quickly, just something Kate said reminded me that faculty and instructors also face their own mental health and well-being challenges. And so it's really easy to feel overwhelmed if you're trying to take care of yourself, and then that this obligation and pressure to take care of others, especially people with numbers like 1 or 200 people in a course. So it is very holistic and integrated. If we're not well, other people won't be well.
Absolutely. Thank you, Janet, and everyone. And Kate, just really appreciating your point of almost looking at this as like a basic need of wellness to get the foundation set. So absolutely. And the next question that kind of carries us into was going to address the biggest barriers, which I think you all hit on really well. So I'm hearing time constraints, that general class size, confidence or lack thereof, not sure where to look for resources, scope of role, all of that fun stuff, if you will. And so I'm curious if something that you've heard or in your experience, like how faculty concerns about overstepping or assuming a counseling role might shape their willingness to engage or not engage with student mental health concerns in their class.
So this is actually a large part of my job in helping faculty understand that it's not their job to fix or solve the problems that they are noticing or observing. And I think that's um, many people are let's fix it folks, instead of like figuring out how to solve it in a way that reduces their stress. And so what I call, and you'll probably hear me say it a couple of times, is learning the art of a warm handoff. So you, as a faculty person, doesn't have to diagnose or treat a student, but really figure out how to give the right resources to the student so that they can make, respecting their autonomy and letting them make the next step. And so one of the things that I try to do is every time I talk to a faculty member, I give them 2 or 3 referral resources, because there's not one place where a student can get help. In most universities, there's at least 1 or 2 places where students can go to get some extra support, relieving the professor or instructor of that pressure.
I'd also say too that I have also heard from faculty, that they're really worried or concerned about the legal ramifications or, the FERPA implications of helping a student. And so that's where I think, from a systems level perspective, it's really, really important that we have the trainings that we have, on those things so they kind of know the line that we have. I also think from a systems level perspective, if maybe you're at a university that has not as many resources, kind of advocating for those resources. I know for a long time we were offered mental health first aid training as faculty, which I think gave and empowered a lot of faculty to be able to say, I can actually handle this if this comes at me. So again, having kind of knowing the resources, like Janet was saying, and then really empowering faculty to know that, the lines that can be drawn and where they can advocate and help students.
Yeah, so it sounds like that education and making sure that there's a clear understanding of the boundaries and what's expected of faculty and what's not when it comes to supporting students in the classroom. Absolutely. Alrighty. Well, moving on to our next question and kind of action steps of what we can do to address the topics we're talking about. I'm curious, what are some small, realistic changes that faculty can make to their syllabus, their tone, assignment structure, communication, you name it, that would help students feel supported without adding significant workload? Because, of course, as we've talked about, that can feel like a pressure as well. So we'd love to hear from one person from each team, if possible.
So something that we work on a lot with our instructors is flexibility. And so especially with large courses, many students have a lot of different things going on. And so instead of kind of trying to retroactively address many different student needs, and that can add actually to faculty workload and difficulty, trying to build flexibility into your course. So it provides kind of a release valve for students. It takes some of that pressure and some of that stress off of them that they may face, for example, in assignment deadlines. And it also helps instructors give students the tools to use that flexibility so that they're not having, 30 emails with late assignments and panicking students. So I can give you a couple of examples of that. So one way to do it that our instructors have used is to provide every single student with a budget of late days or late hours that they can choose how to use in submitting assignments. So this might look like you have a 72-hour late hour budget and you can use it across the semester. So let's say I'm a student, I have something unexpected come up, and I have a major paper and it's due tomorrow. I could use one or two of those days from that budget to turn in that assignment without any grade penalty 2 days later. And so again, that just, recognizes that things come up for all sorts of reasons for folks and gives a little bit more flexibility within a large class like that. One other thing that I will mention, and how easy or light lift this is, I think depends on the individual instructor really and how confident they would feel in this kind of approach. But one approach that one of our instructors uses who teaches a 300-person course is really talking to their graduate student instructors who teach smaller sections, empowering them with the autonomy and really encouraging them and setting it as an expectation that they are proactively reaching out to students who they notice may be struggling. So this might look like a student missing several classes in a row. This might look like a student, having their head down on the desk for an entire class period or maybe 2 class periods. Maybe a change in behavior where a student turned in assignments and then they just totally drop off turning them in. The graduate student instructor can notice that, right? They're meeting in sections of 25 students once or twice a week. So this instructor empowers their graduate student instructors to reach out in a kind tone to students individually via email, check in and see what's going on, and offer things like an extension. And the grad student instructor has the autonomy to offer that extension for an assignment so that everything doesn't then have to funnel up through one instructor with 300 students. So that, that provides some kind of training and support to your graduate student instructors so that they are feeling prepared to do that. But that's something that they found to be really effective.
Love those suggestions. I also think one of the low lift strategies that faculty can use simply is to just normalize wellness breaks, right? Because sometimes in those large foundational classes, students sit for a long period of time. I am guilty myself before I really understood this of saying, okay, do you want to take a break or should we just push through? So that's like not an okay question, right? So normalizing those wellness breaks and actually reframing it to say, let's take a wellness break. Or if you know there's a stretch of class, whether it's online or on campus in a large group, it's important to normalize things like, I'm going to talk like this, I'm going to talk for the next 20 minutes. So maybe invite the class to stand. right? Feel free to stand or stretch or take a pause when needed. Adding that kind of thing to the syllabus can be really powerful. The piece of that that's important is if it becomes a predictable part of the structure, right? So you start the class with maybe a deep breath, everybody kind of doing a check-in, and then later in the class taking that wellness break, then students understand that that's important to their learning style, and hopefully then they can transfer that to when I'm studying, it's important to take a break. It sounds very simple, but again, it's very powerful. It communicates I don't need to just keep pushing and keep trying and stay up all night. I've got to take breaks and let my brain like rest for a minute and switch gears.
I'm going to hop in really quick because I think the breaks are really important. We have a fall break. It's 2 days, and technically it's a study break. And so a lot of professors will schedule exams on that Wednesday after the fall break. So it's really not a break for the students, and that's really rough. The other one is Thanksgiving. A lot of faculty expect students to study all over the break and schedule exams on Monday. And I don't know about all of you, but like sometimes Monday after the 4-day weekend is really rough. Yet we're expecting our students to be on all the time. So really rethinking what those breaks are. And then we've also seen a lot of benefit in faculty sharing their own struggles with failure or test and anxiety, mental health, or asking for help. And a lot of times we open workshops um, up with asking faculty that. And so if they can start showing their vulnerability or sharing that vulnerability in class, which we'll talk about in a little bit, that also helps them become more human to the students.
And I'm sorry, I actually want to jump in here too, just to say one other thing. One time we conducted focus groups of our students and asked them, like, what can we do to help your wellness? And I will never forget this one student being like, just don't schedule all my exams on the same day, which sounds like, it's not a unreasonable request, right? So what we started doing is contacting each other and letting people know when our exams were to avoid that scheduling back-to-back exams for our students. And it has been really helpful, I think, as far as, keeping their stress levels more manageable. And then the other thing that I was going to say too is that I think for faculty, the syllabus is kind of like the intro to the course. And so being very mindful of our language in the syllabus, like, I've seen syllabi that have had like mandatory, like in capital letters. And I don't know about you, but whenever I see capital letters, I feel like someone's yelling at me. So just kind of making those mindful changes even within the syllabus can also really like be much more inviting for the student. They're looking at this maybe on their own to start. That kind of sets the tone for the entire class. So kind of revisiting maybe your syllabus and looking at some of the things that are in there and trying to make it a little bit more welcoming versus daunting. All right, that's all.
Well, thank you all, and please continue to jump in as you have thoughts. This has been wonderful so far, and yeah, I'm taking notes myself. And what's really coming through to me, it sounds like, is the intention behind some of these things, and like you said, Kate, being mindful of how things come across and what we can do ahead of time. Wonderful. So, moving ahead, I'm curious. We already touched on this a little bit, but I'm curious if there's anything else anyone would like to add about what signs of distress are realistic for a faculty to notice in a large class size, a lecture hall of sometimes 100 plus students. I know we mentioned collaborating with TAs or grad assistants, but yeah, curious if there's other thoughts on this as well.
First, I'd like to just say there are different levels of distress, mild, moderate, and extreme or severe. And I think that just takes a lot of time to uh, become familiar with. So I always recommend people getting familiar with the continuum of mental health so you can see what kind of different behaviors are. But in the question that you're posing, I think some of the basic ones are, and they've been mentioned before, are patterns of late work or declining work, affect of the student. Obviously knowing some are busy and some are not, but like the head on the desk is actually a big one. And are they just napping or are they just really exhausted? And then disheveled look, body odor, low affect, and then unusual emotional responses, either in class or through emails or in office hours. So just really being aware of those strong emotions. And I think that one of the things to be aware of is that sometimes a student crying can really freak somebody out, which is absolutely true. If it's somebody that we don't know and they're crying, we instantly like think, "Oh my gosh, it is the end of the world." But really what we try to balance is like what's going on that's making them cry. And sometimes a good cry will actually let them like, whew, okay, gather my thoughts and move forward. And again, there's some wiggle room there, but it's really the first time a student cries in front of you, it can be really scary. And just to be aware that that's actually might be a good sign that they are getting ready to ask for help.
All of those things, I think where it gets very tricky too can be when you have maybe online students, so they're all online and they're in, large groups and things like that. And so I think you do see a lot of the same things, although they may be more difficult to detect, right? So here you want to look, things like missed deadlines, sudden drop in quality of assignments, or consistency of turning things in, potentially submitting work like very like middle of the night, 3 to 5, a.m. So those types of, again, those can be harder to detect, but if you're looking closely, you can see a lot of those things that you would see in the in-person too. But again, it's really being attuned to want to see it as the instructor.
Yeah, absolutely. Again, that intention, if it's there and to know where to look. Absolutely. Thank you. And so pointing this next question to Alice, at least first, and then of course would welcome other thoughts if they come up. But I'm curious what advice you would give to smaller or less resourced institutions trying to adapt some of these larger Big Ten scale strategies, especially considering your position now at Kenyon.
Yeah, it's been my life for the last year and a half. So one of the things that I would say in going from a large system like Ohio State to a smaller system is you don't need Big Ten resources to create big change. These things that we're talking about really can happen in small communities. One of the things that I have to say, though, that was surprising to me because I thought, oh, they're small. This will be easier to create belonging and connections. And the piece I missed was it's also riskier for students to connect in small classes and in small institutions because they're known, right? It's great not to be as invisible unless you're struggling, and then it can be really difficult. So advice I would give would be first start small. Some of the scalable practices that we talked about, like the wellness breaks or supportive syllabus language, faculty-led breaks, brief check-ins, that can really make a big difference. So you don't need a lot of resources for that. Janet talked about having faculty encouraging them to be observers or noticers, not counselors. I think that's really important because, again, whether you're in a large class or a small class, the faculty can feel really pressured to know what to do and say. And then I think leveraging partnerships at small institutions, there are community partners who are more than happy to become involved. So really that has helped. We have peer health educators, and that has made a difference with wellness when there are peers on campus supporting wellness efforts. I don't know about you, but what I have found is students listen to other students in ways that they don't listen to me. And so we have really used them as our like wellness ambassadors, and that's really made a difference. Culture change does take time. And so I think that being patient right? Naming and finding resources, really consistency. And the last thing I would say about it is, again, whether you're at a small institution or a large institution, having leadership value wellness and communicate that makes a huge difference. If leadership doesn't value it, if nobody hears about it, with the exception of some small voices, it doesn't mean you shouldn't have a voice. It doesn't mean you shouldn't incorporate it in your course, but it does mean that actually making a big change can take more time. One of the other things that just as an add-on that I think is so unique about Kenyon, and I don't know if other schools do this, but it has really helped us leverage the importance of wellness. Kenyon is more than 200 years old, and they have what's called Common Hour. So on Tuesdays and Thursdays for the hour and a half from 11:10 until 1 p.m., there are no courses meeting. And they use that as a time to have student groups meet or have wellness events or have speakers to campus. And it's a set aside time that they have every Tuesday and Thursday. And there are no allowable ongoing meetings during that time. And I think it is, now it doesn't mean that classes don't mean later and classes don't mean earlier. Like they make up that time, but something about having Common Hour has really been helpful in moving wellness efforts forward. Larger change, but really a valuable one.
Yeah, absolutely. Thank you so much. Yeah, and that common hour is a new concept to me, and appreciate you pointing out kind of the vulnerability that students can feel on that smaller campus or smaller class size. I think there's definitely pros and cons, like you mentioned. Awesome. And so moving on to our next question here, I'm going to point this one to Janet first, and then of course welcome other thoughts. But I'm curious your thoughts on how faculty and student support services, so like wellness teams, counseling centers, can partner more actively in these large enrollment courses.
Sure, Madison, thanks. I am really fortunate to partner with Elizabeth. We've been working together for about 4 years now, and it's on a project that we call the wellness check-ins for larger courses. And we've done it for small classes of 30 all the way up to classes with over 2,000 students. And it's really a brilliant brief intervention that could be scaled easily for a smaller institution. So I'm really glad that we can talk about it. And it entails a health promotion specialist connecting with a faculty person. And a lot of times, Elizabeth and the Foundational Course Initiative have been the conduits, the people who have connected us to instructors. So it really shows that bi-directional connection. So Elizabeth has connected us with instructors who are interested in embedding wellness into their courses. And I would say, I'm just going to give it very brief, with the health promotion specialist interacting with the faculty member for maybe 30 minutes throughout the semester total. We run this wellness intervention, which is a QR code of 4 questions. How are you today? What are the obstacles or barriers to your academic well-being? Would you be interested in connecting with a wellness coach just to see what's going on? And do you want us to connect you with your faculty member for a check-in? Those 4 questions on a QR code during class time, 5 minutes of class time. And we just had, we are finishing up, obviously, our semester check-ins, and we do it typically during really stressful times. So think fall break, think middle of October. Um, and it's a low effort faculty risk for them. They're inviting us in. They might have to send out a couple of emails, but really low level effort on the faculty part. Um, and the outcome is really powerful. So even students who don't sign up for a wellness check-in or they don't sign up to check in with their faculty member still say they feel like their faculty appreciate them and care for their well-being by just offering the intervention. And it's a really large number. 88% of the class participants say, yeah, this is great. Likewise, 88% say this should be offered in other classes. Um, and so some really great numbers coming out of that. We had a class just recently, 900 students in the class, 600 students completed the survey. And it's not a huge lift on the wellness coach or the faculty member. Out of those 600 who completed the survey, 15 of them asked for a wellness coach session, which is only 20 to 30 minutes. How are you? How can we help you? And out of those 600, 20 asked for a faculty check-in. And what the faculty does is sends a very generic email. Glad you took their survey. Glad you want to check in. Here's my availability or my office hours. Let me know. And a lot of times the students don't even check in with the faculty. They are just getting a warm, kind, I think Elizabeth used the kind words of someone caring for them. And that's what we know about social prescribing, about loneliness, about belonging, is students really just want to know they are seen, valued, and heard. It's a really lovely intervention. I feel honored to be a part of it and leading it out as a wellness coach and as a faculty liaison. And if you're interested, we can always talk more about that and come see us in Chicago because we are presenting it at NASPA Strategies.
Wonderful. That'll be fantastic at NASPA. We got to go last year. So congrats. That'll be great. Awesome. And yeah, and thank you for sharing, Janet. Wonderful. Okay, so moving on and zooming out a little bit, I'm curious to hear what institutional policies or practices have made it easier to embed well-being in teaching at scale. I think one person from each institution, if possible, would be great.
I'll start. I think that the one of the most helpful institutional practices, both at Ohio State and at Kenyon, have been like the clear message that well-being is shared. It's a shared responsibility. It's not just where, you go to the counseling services to get well, or you go to the student wellness center to get well, that it's really valued by the leadership. Because when that happens, especially when it happens in that academic affairs and academic sphere, then faculty feel permission to integrate it into their teaching and feel like this is an important thing to do. Another practice that I think is really important that comes from that are really this ready to use tools, right? So having that at the ready, right? Like, so in the initiative that Janet just talked about, it's like, here it is, it's simple, we can embed it. And I know Kate has done that in her large classes with just doing what looks like a weekly extra credit activity. Of course, if you do all of them, the extra credit is not enough to change your score in any way. But it kind of says this is what we value. But what we did at Ohio State was we created modules so faculty could choose from modules and do what we called plug and play and put them into their course. And they said sometimes it's as simple as every Friday sending a nice message or a funny note, or yay, it's Friday, here's some video of babies laughing. But those kinds of things, the ready to use tools, the policies supported by the leadership makes a big difference. The other thing I would say is like really clear referral pathways. We don't want to do a check-in and say, are you okay today? And find out a student isn't and not know what to do with that. So that as an institutional policy makes a very big difference, right? So aligning the messages with the resources, with the expectations, and normalizing that it's okay to be okay. It's also okay if you're not okay. And there's some things that we can do about that. I think that's been really valuable. And one of the initiatives that we did because we had those things at Ohio State, not only did we teach students that it was important for them to be well, but we actually then had them have wellness partners. And so they coached each other in wellness. And then once they had that experience of having had a wellness coach, it was much easier then for them to partner with patients and in clinical settings and coach wellness in those settings too.
Thank you, Alice. Yeah, and you touched on the leadership and the value that coming from the top down can have. And we do have an audience question and buy-in from administration here in a few minutes that I think could be really valuable. Is there anything else anybody wanted to chime in on for that question before we move along?
The other thing that I will just throw out, just because it is about sometimes lack of resources or ability to promote things, if you senior leadership, of course. But one thing that I found very helpful for me is understanding the JED Foundation. And it's great that JED Foundation partners with all sizes of colleges and universities, including community colleges. And so they are always looking for people to call it institutions to partner with. And they helped me really see the landscape more clearly.
Yes, JED Foundation is a fantastic resource for anyone who's not already familiar. Highly recommend checking that out.
Another thing that we have done at Ohio State from, it's kind of, again, when you look at like a systems level intervention, is we have kind of this philosophy. It's called like a live well philosophy, and each letter stands for something. But importantly, one of those is wellness focused. So that's the W of it. And so what we did is we took this philosophy of live well, and what we did is make live well classrooms. And so as part of like, if you wanted your classroom to be a live well classroom, you had to say, we're going to take breaks every 40 minutes. We're going to, encourage water. We're going to support each other. And we were actually able to get a live well statement put into syllabi. So I'm actually going to put that in the chat. I was able to dig that up just to kind of show you guys an idea of what goes into the syllabus statement, and then those classes in particular. So it's sending the message to students, again, this is really important to you. Your well-being is important.
Wonderful. And thank you so much for dropping that in the chat, Kate. I think that's a great example. Awesome. All righty. Well, as we come to the last few minutes of our discussion here, I want to ask all of you, for faculty who feel overwhelmed or unsure where to start, what is a meaningful first step that you would recommend that they could take following today's webinar?
I guess I'll go again. I think, this can really, when you start thinking about things, it can be really fun. It can, allow you to do some more creative things, but a really just welcoming way, I think, to start class is just to play music. When students are coming in, or you can do it online or you can do it in person, just play music. And that just kind of sets the tone. This is light. This is, supposed to be low stress. But that can be a really good way to start. And then I do very firmly believe that every syllabi and every course in the online platform needs to have those wellness mental health resources. So students need to see that and hear it actually too multiple times throughout the semester. So obviously at the beginning and then midway through or any other stressful point, it's important for faculty to remind them of the resources that are available. And also, I would say to extend the invitation that if they have any, concerns or if there's anything going on, they can always reach out to you.
In my context, if this was a U of M audience, I think the recommendation I would give for the first step or the first couple steps would be to engage with that self-paced Canvas course I mentioned, which is really designed for exactly this purpose, to help faculty members gain knowledge, gain skills, gain understanding, gain confidence in taking a proactive approach to supporting student mental health. And I think that's, like we were talking about earlier, it's really hard to know what to do when you feel like you don't know what your role is, or you don't know what signs to look for, or you don't know how to follow up or where to hand people off to. So gaining some of that knowledge and gaining some of that confidence, I think, is a really important step. I think I heard Alice and Kate, you both shared kind of different resources for faculty learning and for professional development that exist at your institutions. I know it's not everywhere yet. I know sometimes there may be, information that's more and less comprehensive. But I think if your institutions do offer any kind of professional development, whether it's a workshop or an asynchronous self-paced module or something like that, I think, taking that step with, the time that you're able to, gaining some knowledge, gaining some confidence can be really helpful in feeling equipped to support students.
I would add not to be afraid to be who you are, right, as a faculty, to be authentically you. So you don't have to incorporate wellness in a classroom the way I would do it, or the way Kate or Janet or Elizabeth would do it. I had a faculty once say, I'm not doing this, I can't do this. And this was just a recent conversation, and I'm like, tell me about your course. And what I found in that conversation was she had a very predictable framework, and it was student focused. And I said, maybe the wellness in your class is that it's predictable, that the how you start class, how you do class, how you finish class, and what the expectations for class are very predictable. And that's okay. That's actually probably very comforting for the majority of students because they have clear expectations. And so a lot of this, I think sometimes as really good faculty, we think, oh gosh, I've got to add all this. And really it's about thinking through what it is you do and naming it. So what I would say to you is take a look at your course, think about how you really do care about students, and name that. So again, taking a wellness break, starting class with a moment to collect themselves. All of those things that make sense to you will make sense to your students too.
Those are all great ideas. I think the only thing that and I'm just going to go after what Alice is saying, is encouraging faculty and instructors to be curious about where they want to grow. Sometimes we always think, especially if we've been in it for a while, like I know all the answers, I know what to do, and just being really open to say, like, what are some ch shifts or changes I can make? Um, and we did this really great workshop on like low hanging fruit, medium changes, or really high level changes. And so really recognize what you're capable of and who are you hanging out with? Like, who are the people in your community that could help you make some changes that are reasonable and effective?
Absolutely. Thank you so much. I love all of those suggestions and especially ending on that note of kind of having a spirit of curiosity. I think that can carry us far in wellness and beyond. So wonderful. Alrighty. Well, in our last few minutes here, we did offer an opportunity for audience members to submit questions prior to the webinar. And one of the top ones, like I mentioned a few minutes ago, was how do you get buy-in from administration to implement some of these, specifically, I guess, more higher level interventions, but generally speaking as well? I'm curious what your experiences might be with that.
One of the places that I would start is looking at not only value of investment, but return on investment. And so one of the ways that we were able to start and continue a peer educator program was looking at, for every dollar invested in a wellness program that has peer educator, there's at least $3 in return in terms of student overall mental health, in terms of wellness in general of faculty when they have partnerships. The other return on investment piece is that that depending on where you are using that Healthy Mind study, because it became clear to us that 60% of our students who do not return, who leave campus for a reason, it's usually a mental health reason. And so when we look at that and extrapolate that, there's a lot of tuition lost. And so, yes, students value wellness. Students feel differently when we incorporate it in the classroom. They learn better. But when you look at the actual ROI, there's dollars tied to these efforts.
I think the success of our wellness check-in, and Elizabeth, you can jump in if I'm missing something, but we had senior leadership buy-in pretty right early on because we had multiple campus stakeholders from different units. So we had academics, we had well-being, we had the Center for Research, Learning, and Teaching. So plus the faculty members themselves. So there are 5 or 6 key stakeholders or different units involved. and it aligns with our student success initiatives. So figuring out how to thread the needle is the number one way to push forward your initiatives.
Another thing just to consider is I recently heard a statistic about college students who try and attempt suicide. Usually, if they're unsuccessful, say that the number one reason cited for the suicide attempt was because they didn't feel like they belonged anywhere. And so wellness and belonging are so intertwined that it is our role and our job, as faculty administration to make our students feel that they belong.
Absolutely. And thank you all again so much for your vulnerability in sharing, your kindness and empathy in sharing the ways that we can better support students in their classes, and more specifically that faculty can support students in their classes. So as we come up on the end of today's session, I just want to thank all of our speakers again. Thank you so much, especially during Rivalry Week. It looks like we've already got wonderful feedback in the chat. I found this personally helpful, so thank you so much again. And then just wanted to reiterate for the audience that the activity code for today is 52RAGS to get your CE credits. So thank you all so much again. Take good care and have good holidays to those celebrating.